What's going on, everybody? Welcome back to the channel. Welcome to the channel if you're new here. Quick disclaimer, this video is probably something most people aren't even going to care about, maybe unless you follow me and you care about, like, a YouTuber's health or whatever. But this is more like a plea for help and maybe some information, I guess, to doctors all over the internet. So I got to tell a long story. I'm going to talk fast. I'm going to try to keep it as short as possible. Let's get into it. All right. So about 6 years ago, I was injured at work. I don't think any of these things are related, but I'm going to give full context here because I'm absolutely at my breaking point. I was injured at work. Went through workers' comp, tore my bicep tendon, my rotator cuff, had to have surgery. Along this time frame, while I'm waiting to have surgery and negotiating with workers' comp, I woke up and my back was crooked, just out of the blue. Didn't injure it prior, I don't think. It was a normal day before. The next day, my back was crooked, and as the weeks progressed, I couldn't even get out of the bed. Well, I had to put that on the back burner because I was working on getting the surgery for my arm. This surgery, after completion, did not go well for my arm. I lost 25% use of my dominant arm. Okay, moving forward into the back stuff. About a year and a half later, a year later-ish, after the whole work comp thing was all over with, said and done, I woke up one day and my back was crooked again because it had straightened itself back out. But anyway, it was crooked again. And then I went to the doctors. Doctors wanted to have back surgery. I had back surgery. Back surgery didn't go great. Still have chronic back pain. Okay, about 9 months ago from now, from today, from the time I'm posting this video-ish, give or take, I started having these electric shock sensations in both of my feet. And at the time, I was thinking, oh my God, they must have damaged some nerves in my back when I had the surgery, and that's what this is. And I'm thinking, well, I got to get this checked out. So I go back to the doctors. I'm going and seeing all these different doctors. I'm seeing like 3 to 5 doctors a week, every week, pretty much on a regular basis. And have been for the last 9 months. That's really been the story of my life for the last 6 years, because between all the surgeries and everything and I've been going to the doctor nonstop. But anyway, as the weeks progressed since the beginning of the flare-up, it moved into my abdomen. Now, I had them in my feet and my abdomen. So when I have flare-ups, it's every body part that I'm naming off affected all at once. It generally starts in the feet, and then mere milliseconds later, it's in every body part that I mention here. So a couple weeks after the initial, or a month or two after the initial flare-up, it was also in my abdomen. And I'm thinking still at this point, must be nerve-related, waist, feet. I had back surgery. That would explain a lot because it was my lower back, blah, blah, blah. I'm going through all this crap. The flare-ups are getting more intense. They're moving. It's crazy. Now, when I have flare-ups, voice crack. Now, when I have flare-ups, it's in my feet, my abdomen, my arms, and my chest, and sometimes my face, and only when I'm asleep, in my tongue. Now, this is all in the last 9 months. It moved from the bottom of my body all the way up to the highest point, the head, which freaks me out a lot. This has caused tons of anxiety. It also causes tons of pain. It has drastically affected my daily life. I can't do anything. I don't get over here and upload videos anymore. Really, I don't do anything. I pretty much spend all my time in the bed. And I walk with this. So, and I'm not that old. I'm unk status, but I'm not that old. This is literally driving me insane. I've been waiting months for a skin biopsy for them to confirm whether or not it's small fiber neuropathy, which, they've confirmed and not confirmed some other things. They did some blood work. A lot of the blood work was coming back fine. But I've been waiting to get you have to go through the motions. I've been waiting months to get this small fiber neuropathy test, which is what they think that it might be, based on the symptoms I'm describing, which is electric shock and burning, and it's affecting all those different body parts I mentioned before. I get a message. First of all, yesterday, let me back up a little bit. Yesterday, I had to go to the ER because I had a flare-up that was so intense, it scared me like half to death. The flare-up started in my chest, which does not follow the normal pattern. Normally, my flare-ups are in my feet and then work their way up to the chest and the face and the other affected areas. But this time it started in my chest and it was super intense. I got short of breath. My chest got tight. I thought I was having a heart attack. Went to the hospital. EKG, totally normal. Blood levels for, I think it's the troponin is what they test for, which is what releases into your body. I believe that's the one that releases into your body when you're having a heart episode. No arrhythmias as far as I know. They didn't mention any, and my heart was fine. Left the hospital. So here we are today. Today I get a message from my neurologist about the skin biopsy, and they tell me that it was denied by my insurance, which is weird because 2 days ago I got a text and a phone call from the people who do the approvals or whatever, and they told me it was approved. So that's the first weird red flag-ish thing. And then I call the insurance company after I get this message from my doctor, and the insurance company says, oh, we never got a request, so I don't even know what you're talking about. Weird, right? Basically, the doctor tells me, I'm going to read this verbatim because I don't want to paraphrase it, but it just rubbed me the wrong way, and I want to see if anybody else kind of gets the vibe that I got. And again, this video is for doctors. I mean, obviously, if random people see it, post it on YouTube. But I'm trying to find out if you are a random person, you're not a doctor, if anyone's relatives have ever experienced this and what they were diagnosed with. Because I feel like my symptoms should be pretty easy to narrow down as far as like, oh my God, this fits this pattern. And I would really appreciate all the help that I can get. And I've done a lot of research on my own too, by the way. Okay, so let's read this message. By the way, they had checked my adrenal glands. They wanted to make sure those were operating normally. My blood work was normal. Shocker, always is. Unfortunately, your insurance does not cover the skin biopsy. As we discussed before, it will not change the management, just confirms your diagnosis. Okay. Now, I take that as they're saying, oh, it's small fiber neuropathy, right? That's what they're labeling it as. I still want concrete proof of that with the skin biopsy. So I got to clear up this insurance crap. However, they're saying it's small fiber neuropathy, but they're like, oh, it doesn't matter if we prove it. Well, turns out, based on the research I've done anyway, small fiber neuropathy can be caused by loads of things. Cancer, autoimmune diseases, different things like that. They've done some tests. I can't even talk. They've done some blood tests and stuff like that for things, which most have come back normal. So, I guess it could still be, based on what I've read, it could still be autoimmune, could still be some underlying like cancer or something they're not seeing, they haven't found yet. But I need it concrete on paper, right? And I got to clear up this insurance stuff. But I'm just going to reiterate my symptoms one more time real quick, and then I'm going to try to close the video out. I might ramble more. So this started like 9 months ago, all right? I feel like the timetable, we're going to say between 7 and 9 months ago. And I feel like the timetable is very important because of how rapidly I feel like this has spread. It was in my feet, both feet at the same time, electric, burning, shocking, feels like I'm getting bit by a million fire ants at one time, kind of pain in my feet. Then it moved to my abdomen, so it was my feet and my abdomen. Then it went to my chest, my arms, and my face and stuff. So when I have a flare-up, all of those body parts are affected at once. And new symptom that I've noticed in the last 2 months is I profusely sweat on my back. My face turns red and I get hot, but my back pours sweat. Now, gross, I know. Gamer sweat. Let's bottle it and sell it. Sick gamer sweat, right? Anyway, so those are the symptoms. I'm going to totally ignore my chronic pain and stuff. I don't think that it's related. I really don't. I think it's totally something separate and they just haven't figured out what it is yet. So any doctors out there, if you have any idea what the causes of this could be, you've ever dealt with patients like this, people in the comments that might see this video, if you have a relative that has ever experienced any of these symptoms and you've heard them describe these symptoms, please, God, tell me what they were diagnosed with. You don't have to give names or any of that crap. Age potentially might help. I'm 35, So I don't know if the age gap, if somebody's 70 and they have these symptoms, if that makes a difference. If I'm 35 and have these symptoms, I don't know. But anyway, yeah, this is also a rant because I think the healthcare system is way too complicated. It shouldn't take me 5 months to get into a doctor. It shouldn't take me another 5 months to get the test done, just to be denied to get the test done, to then, have to fight all this crap through the insurance and the doctors and figure out who screwed up. I feel like a lot of my doctors just don't give a shit. I've switched doctors. I don't know what else to do. I'm desperate. I'm freaking out. This is really taking a toll on my mental health. It's breaking me down physically and mentally. Not to be, a sappy Susan on here, you guys. Jesus Christ, somebody please give me answers. I hope this video reaches enough people for me to figure maybe something out. See you all later.